Hi everyone watching. We're gonna add Dr. Equils before we start so we can start right at 5 p.m. Hi!
Hello.
So everyone, this is Dr. Equils and I'm Christina Kogor. I'm an incoming junior at the King's Academy and the Executive Director of Public Relations for United2Care. And today I'll be interviewing Dr. Equils, who is a past Associate Professor of Infectious Disease at UCLA and the current founder of MEOR, which is a public health education nonprofit. And our main topic today is just talking about the growing COVID-19 pandemic. So before we start, I just wanted to ask you to tell us a little bit more about yourself before we dive into the questions that we have coming up.
I could not hear that. It just cut off. What did you want me to talk about?
Oh, just tell us a little bit more about yourself before we get started.
Sure. With the technology, obviously, it's becoming more challenging, right? So I'm a pediatric infectious diseases physician, and I am a scientist. I did animal research, basic research, clinical trials during my academic years. And I got patents, and I got those patents licensed. So I had that experience. And then I moved into, from academia to pharmaceutical industry, and I worked as a medical director for a large pharmaceutical industry and learned that aspect of drug development and vaccine development. And while I was in the pharmaceutical company, I started the nonprofit because I think everybody can, if work together, we can accomplish more, we can achieve more. And especially if we can engage young people like yourselves who are hardworking, intelligent, and passionate, we can definitely accomplish more. And most recently, I started working as a physician in the LA County Department of Public Health COVID outbreak response team. So my job there is to oversee the outbreaks in nursing homes, in homeless shelters, and other community type of settings, police departments, and workplaces. So have a different kind of experience from the public perspective. And the reason I wanted to tell you can change throughout one's life. So when I was young, I was thinking, okay, I want to be a doctor, and that was my goal. And as you are going through your life, you see that things change. And as long as you do what you are passionate about, so it's very important finding what you really love to do. I love helping people. I like thinking. I like problem solving. And then you can kind of find your way. And I would say, it's a long answer to your question, but try to do the most difficult thing to do and the hardest thing, push your limits. Try to do the as much as you can. And you guys are doing that. You're doing a great job.
Yeah, thank you. That was amazing. And congratulations on all you've done. It's like a lot.
Thank
It's
you.
really amazing. But moving
Yeah.
on to our first question, can you explain exactly what COVID-19 is and its virology?
It's a good question. It's a positive strand RNA virus, and I'm sure you guys have been reading about it. So that means it does not require any special machinery once it gets into the cell to replicate itself. It doesn't have to incorporate into anything, but once inside the cell's own machinery starts replicating the RNA. And when you think about it, think about like a dust. And when you're talking to people around you, and you're the junior healthcare providers now, you can describe it as a dust particle. So it is very difficult. It's very sturdy. And actually, when you look at old literature, some people think that the life started with an RNA. So if you think about the origin of life, and so how sturdy it is, and with the pH differences in the ocean waters and whatnot, and the basic and the acidic and the volcanoes and whatnot. So that's what COVID-19 is. It's very similar to, I shouldn't say very similar, but it is in the, when you think about coronaviruses, they are cold viruses. And every season when we get cold, there are other coronaviruses that circulate. Last year when you got a cold, there were other coronaviruses. So think about it in that family of coronaviruses.
So our second question is, what are some preventative measures that the U.S. has already taken to stop the spread of COVID-19?
Of course, everybody is looking at what would be the most effective strategy. Closing the borders, definitely effective. But when you think about how the virus spreads, again, think about dust. It's aerosolized, it's in the air, and it can settle down. And if you kind of shuffle it, it can come up in the air. So there's question about aerosolization, right? So it spreads in small, confined places. So what US did was, we did shelter in place. So everybody initially isolated and socially distanced, because again, you're coughing, you're talking, for example, singing, right? A lot of things come out of your lungs, and a lot of particles, dust particles come out. So distancing, that's one of the measures that was implemented early on. Hand washing, obviously, is very important for any infectious disease. And I'm not sure how much emphasis we're putting on hand washing. And masking. Again, if you think every time we're talking or singing or laughing, these little particles are coming out of our lungs. And so mask is very important to protect the other people. So those are some of the measures. So again, going back, small space, so distancing, social distancing. They close the different venues, especially crowded, sports events and bars and concerts where people are sitting next to each other, right? And those were some of the effective measures. Closing the restaurants, again, think about somebody's cooking back there, or people are sitting right next to each other in a small area. And most of the spaces that we're sitting in have air conditioners. So the space is not getting fresh air from outside. What happens is air is circulated. Again, the number of times the air is circulated is very important. Again, I'm saying these things because, again, for young people, there are many different aspects of healthcare, from engineering to environment, and they all affect each other. I hope that answered your question.
Yeah, thank you. So the next question we have are, what are some similarities and differences between the current growing COVID-19 pandemic with previous infectious disease outbreaks such as the yellow fever or polio?
That's a good question. Again, during polio, those are different diseases. Obviously, the way they spread is different. And polio is more like a gastrointestinal tract infection. And they used to do quarantining, isolation, avoiding pools and whatnot. And it's usually transmitted from children to children and affects young children. And so the recommendations and guidances for those were different. Even actually recently, I was looking at the influenza pandemic preparations, and the experience with those past pandemics is very different than what we're experiencing now. For example, with SARS, CoV-1. So think about the coronavirus, SARS viruses, and this is now CoV-2, but there was a SARS-CoV-1 around early 2000. So think about these as cousins. Even that was different. It did not affect children. It wasn't that contagious, and it affected more healthcare workers. So the way we are dealing with this outbreak is we're learning it as we're going through it. And early on, it looked like children, for example, young people, at least younger than 10 years of age, are not affected as much. But then, because they are not affected, but the older people, maybe, it looks like there's definitely an age related. As you get older, the disease is affecting you more, but then you could be asymptomatic carrier. So just to cut it short, we are learning more about it as we are going through it.
Mm-hmm.
Did that answer your question?
Yeah, that was good. Thank you. So the next question. Anytime soon, and if so, what's your best estimate on when it would be publicly available?
That's a great question. When you think about vaccine development studies, there are different phases of this. Obviously, you can always put something on the I'm going to use the word market. You can always put something out and say, hey, I have a vaccine. You always have to think about how much do I know about the effectiveness of this vaccine? How much do I know about the safety of this vaccine? And you guys think about when you get vaccines. So those vaccines usually going through the in vitro, in the bench, in the laboratory, and then goes to the animal, and from the animal, phase 1, phase 2, phase 3. And sometimes, like for example, there was a meningitis outbreak at University of Oregon. And there was a company, I was involved in that, a vaccine that wasn't actually approved yet, but it was kind of pushed because there was an outbreak in the college setting. So you can administer vaccines like that. Again, you have to always think about risk and benefit. In terms of, are we going to have a vaccine? I think there are going to be some companies. And today I was hearing a presentation, maybe early January. And now, what does that mean? When you hear about there's good response to vaccine, what does that mean? It means that when you inject it, the body mounts an antibody response. So your immune system recognizes it and mounts a response. But you don't know if it's protective or not. And that only testing that requires time, right? That's why every flu season, for example, towards the middle of you hear, oh, vaccine was 40% effective. Vaccine was 50% effective, right? That means vaccine was effective in preventing flu. So we don't know yet. The people who are mounting immune response, but we don't know if that immune response is going to actually stop preventing infection. We don't know that. And again, you may be hearing about, well, let's give sample the virus, so immunize people and see if it's going to prevent it or not, right? Those experiments, those trials are very tricky to do. from ethical reasons. Of course, those people are so brave and so kind to, you know, serve the public to go through that. But usually those are younger people, and there may be some older people. Again, you always have to think, how can I extrapolate the data from a 30-year-old to a 65-year-old? Because their immune systems are very different. So you have to think about that. Even if a vaccine is available, there are lots of different aspects to it that needs to be considered.
Yeah, there's like a lot of factors contributing to it. Is it safe? But at the same time, you can't look at one person and count that they have the same exact body or health as another person, which is a really good perspective to understand, because so many people are trying to push for a vaccine because they want this, obviously, this whole thing to be over, but it's not as simple as it seems. Moving on to our next question, what are some steps that we as a community or as individuals can take to stop spread COVID-19?
One of the most important things is socially distance. So don't get too close to people in the grocery store. You know, it's hard to give your parent a hug, but trying to stay away. That is also difficult. Hand washing obviously is very, very important, because we know that this is a respiratory tract where it enters in your nose, in your mouth, in your mucosa. Mucosa means wherever it's moist. So you touch your hand on something, high frequency touch area, and let's say on the TV, and the person before you, let's say, sneezed and covered their mouth with sneezing, and they didn't wash their hand, and they touched the remote control. Now you're touching the remote control, and now the dust or virus is on your hand, and then you go rub your eye, and now you put it in your eye, and that's how one gets infected. So frequent hand washing before every meal, after every meal, in the morning, in the evening, after every bathroom.
Mm-hmm.
If people are feeling sick, they shouldn't go to work. They shouldn't go be with crowds. You know, in the past, like, oh, I never missed a day of school. Now, no, one has to take care of themselves. If they feel like, oh, my nose is scratchy, and the symptoms are, you know, I'm not smelling, I lost my smell, or I'm nauseous. Finding out more about the symptoms, diarrhea, for example, headache. Everybody has fever, but sinus pain, nasal congestion, all signs of COVID. So if you feel like, something doesn't feel right, then avoid people. Those are some of the things we can do.
Mm-hmm. And kind of tying to that, tying on to that question I just asked, this is our final question, but can you just reiterate the importance of how important it is to be constantly washing your hands or to be wearing masks this year?
Very important. Hand washing is very important for any infection, any infectious disease, right? That's how we spread things around. So you wake up in the morning, you wash your hands or take a shower, and before you eat, after you eat, right? Because when you're eating, you're putting things and you're touching the food. So your food is, think about dust on your hand, gets on the bread or gets on the whatever you're eating, gets into your mouth. So after you eat, you wash your hands. After every bathroom, wash your hands. And in the evening. So hand washing is very important. With the face mask, again, I was listening to another presentation this morning. It was funny, but it's think about it like your underwear. You wash it every day, your face mask. And face mask is not 100%, the cloth mask is not 100% protective. So just because you have a mask and the other person has a mask doesn't mean that you can be right next to them. You still should stay away. Surgical masks are more effective, maybe 70%, but cloth masks are around 30%. and it's to protect the other thing is, in addition to, so there are masks with vents and the valve. Those are not good to use. So if you see someone with a valve, stay away from those people, because the air they breathe out is coming out through that valve. So it's almost like they don't have a mask.
Oh, wow. Yeah, I know a lot of people thought that it was good to have that ventilator, but actually it's quite the opposite.
Right.
I think, yeah, that kind of wraps up all of our questions. I just want to thank you so much again for explaining and emphasizing the importance of the growing COVID-19 pandemic and what we as a community can do to stop the spread and to keep not only ourselves but others safe. And moving on to the second part, or last part of the interview, we're going to open the comment section to any questions that any of the listeners have. So if you have anything you want to ask Dr. Equils, you can comment it down below, and I'm sure you'd be more than happy to answer them if there's any questions.
Sure. And they can text you or email you or Instagram message you the questions as well later. And while we're waiting for the questions, how is the pandemic affecting you, young people? What do you think?
I know for me personally, it's really hard because when you're a teenager, you want to be with your friends and you have so many things or experiences that you really want to do, but it's hard when you can't, whether it's sports or going to hang out with your friends, that you're kind of limited at the same time. But you have to think about long-term versus short-term. Like short-term, you may have fun, but long-term effects, you could be putting your friends, your family, and other people at risk as well, which is a lot of things to take into account before you make a small or large decision such as that.
Absolutely. And of course, anxiety, depression is reported very high among young people. So what does, again, I'm asking to you, but more about, you can answer for United2Care and the young people that you know. What are some of the effective measures? What do you guys do in terms of bringing down the level of stress and anxiety?
I think something that's really good is even if you can't physically see your friends, whether it's texting them or FaceTiming them, can be extremely beneficial because you're still getting that one-on-one connection with them without having to be there with them, and also having either daily or weekly family events that you can look forward to, whether if you're not feeling extremely great one day, you can look forward to something that you already have planned, whether it's a small thing like playing a board game or renovating and airing your house. Like anything is really beneficial, especially in times such as this where we have to be home and think about the safety of others.
Absolutely. And one thing I would add to that is exercise. I know most of us is not going out, but one can do high intensity or just sit-ups and push-ups in a small space, right? Exercise is extremely important. Breathing, diaphragmatic breathing, and you hold your breath and you push the diaphragm down, which activates the parasympathetic system. And then you breathe out and you repeat that 2-3 times a day whenever you feel stressed, or if one can't go to sleep before sleep. Those are very effective as well. And we know that with COVID, being healthy is very important. People who are overweight, people high blood pressure, so eating salt, for example, high amounts of salt, blood pressure, and eating healthy, definitely decreases the risk for severe COVID. So one thing I would recommend is you can start a Let's Get Healthy campaign. While we're at home, let's every day start with 5 jumping jacks and increase it to however many we can. Let's drink more water. Let's meditate. Listen to music.
Yeah, that's really good. I actually started doing that as well, and I found it's really helpful to have either a friend or a family member to do it with, because it not only pushes you, but at the same time holds you accountable for, I should be doing this just in general to keep myself healthy, but it will also kind of build up my health and immunity system to protect myself against certain viruses such as the COVID-19 or just the common cold like you were mentioning before.
Absolutely. Do we
If
have
you
any
have,
questions?
I know, yeah, I was going to ask that. Feel free to comment any questions you have. There's no right or wrong question, whether it's small or large. I'm sure we'd be willing to talk about it, so please feel free to comment anything below.
How about your schools? What are you guys going to do at homeschooling?
Yeah, we're going to be having the fall semester starting online unless something drastic happens where we can go back to school. But if we do reach a point where we can go back to school, we're going to start a hybrid approach where we have two groups go to school. There's two separate groups. So group one will go to school while group two stays at home for 1 week, and then the next week it switches. So you go to school to learn, but at the same time you stay home so you're not overexposing yourself to others.
So one thing I would recommend is, and I would recommend
I think there was like some sort of connection error, so we can get the live started right back in really shortly. But in the meantime, comment any questions, and I'm sure we can scroll through and like answer all of your questions if you have any that you want to ask. It's connecting right now, so it should be up and running in a few seconds.
Hello.
Hi, I think the connection's a little static segments. I think the connection isn't working right now, but in the comments, Dr. Equils, I think, has. Oh, yeah, she answered the question in the comments below to, I think, Arun's question, but if for any opportunities, if you as a high schooler want to be part of the public health, the nonprofit that Dr. Keels started herself. If there's any other questions you have, you can comment it below. Oh, I think the connection's working now. If the connection doesn't work, you can still comment your questions and we can respond to them in the comments, so you still get an answer. Oh, hi, Hendon. If you have a question, you can ask it in the comments. I think we'll probably have the Q&A go on for a few more minutes. So if there's anything you want to ask, you can comment it below. Okay, I think if there's no other questions, I think we're going to end the live stream, but if there's anything you want to ask, you can always message the United2Care Instagram, and we can ask that to Dr. Keel, so you still get an answer to your question. But thank you so much for watching and joining the live stream, and I hope everyone has a great day. Oh, I think we'll try one more time to accept the live stream. Yeah, there's some sort of connection errors, but we'll try and start it up again so we can get any last questions that any of you guys have.
Hi.
Hi.
So what I was saying was, this is true for wherever you are, and your parents too, if they're going out, always carry alcohol wipes or cleaning, EPA approved cleaning material with you when you go to school. And when you sit down, this is what I used to do in the clinic. You clean your table, you wipe your table, you wipe your chair, wherever you're sitting, even though it's supposed to be clean and it's cleaned, you'll at least feel more comfortable. Your parents feel more comfortable when you're going to, you said you're going to, if it opens, you'll go, maybe there'll be 2 different classes, so you can carry your own cleaning material with you, and you can clean your surroundings wherever you're sitting.
Mm-hmm. And then I think you already answered Arun's question about if there's any high schoolers who want to get involved in the nonprofit. Are there any steps that they should take in order to help at all?
Sure. So we are starting together with the United2Care. We're starting a campaign in the Bay Area, Stop COVID at Home campaign, and you can be involved with that campaign. So they can contact you, they can contact Arun and ask how they can help. Of course, trying to help with the fundraising, trying to help putting together the kits and distributing the kits. Because it's very important to educate people on how to isolate at home. Even if we have, more than one room, again, we want to be close to our parents, especially if we're not feeling well, but that's we can't do during the pandemic. So the Stop COVID at Home goal is to educate, inform people what to do at home so everybody stays safe and the virus doesn't spread inside the house. So they can be involved in that project. At Miora, the nonprofit that I started, MIORA, again, .org, they could be involved in data analysis, manuscript development, again, Stop COVID at Home project, but other projects as well. And advocacy, policy type of efforts. If you look at Miora Connection on LinkedIn, you will see what our students do. If you go to PubMed and type Miora, or you put my last name, you would see publications that our students did in high school. And they get to work with other experts in their fields and start networking. And in the past, of course, they attended conferences, scientific conferences, and presented their posters and whatnot. Now those conferences are online, so they could be involved in stuff like that.
Mm-hmm. I think we had another question that somebody asked. Their question mentions what are some virtual biomedical internship opportunities for high schoolers?
Virtual biomedical. The first thing that comes to my mind is around data analysis, around looking at literature, looking at collected data or collecting data. So there's already data collected. So our students are involved in analyzing that data, but one can conduct other types of surveys online and analyze that data. Now, one has to be careful because if you want to publish data, you need to have IRB approval for the protocol, for the survey and whatnot. And you need to learn how to protect the subject or whoever's responding survey privacy. And on Miura, we have, our website is currently undergoing revision, but we have a free HIPAA certificate training and we pay for it. It's from University of Florida and it's good for 2-3 years. It's nationally recognized. So they could go in under the resources tab and they could do that and they can conduct survey projects, conduct surveys. More biomedical, they could be, I mean, one of our students, for example, involved in just submitted a manuscript on copper and about bioengineering, again, from a more bioengineering perspective. So read a lot and see what's going on. And if you have any thoughts, any ideas, then look at the literature about you can see if there's any opportunity there to develop something novel. So those are some of the things that I can think about.
And I think we have 2 more questions. The first question, somebody asked, how can they help during times such as these?
Very good. So start with the first yourself. And again, implement some of these healthy eating, exercising, and meditating. But also start again looking at people around you who needs help. It may be right inside your home, in your family. And if you want to be a healthcare worker, a doctor, for example, in the future, you can just start right there. And you can start educating people. So there are a lot of material available online from CDC. There's material available actually on our website when hopefully soon it will be coming up. And so you can start educating the people around you. You can talk to your aunts, uncles, and kind of create a network of sharing, reliable at-home project is a way to help. And at Miura, we have other platforms, for example, diabetes prevention or medicine. And it doesn't have to be with just Miura. There are many other organizations, but you could be involved in an organization like that and reach out to people and help people and spread information, spread knowledge. Those are very, very helpful. The most important thing before forgetting, let me tell you, collecting data. Let's say you reached out 10 people. So let's say next year your teacher asked you, what did you do? Well, I reached out to my family members. That's not actually a very mindful way of doing it. So keep an Excel sheet and keep track of who you reached out. What happened? Did they respond positive? Did they respond negative or not respond? What did you do again? So then at the end of, let's say, week, 1 month, 2 months, look at this overall data. And so when your teacher asks you what you did, you won't say, oh, I just people. You can say, well, I spoke to 15 people 10 times over 6 months. So it's more concrete. And you will be then also doing what you're doing in a mindful way. You know, with this person, it didn't work. Why didn't it work? Maybe I need to use a different approach. So then you can say, well, in 3 people, I changed my approach, the way I communicated the information. I gave them different kind of flyers and they responded. So you see what I'm saying? There's going deeper, try to go deeper and more mindful.
Yeah. And then the second question that somebody asked in the comments was, is it ever okay to publicly shame someone who doesn't wear a mask in public?
Right? Putting, and this person is exposing me, right? So whatever you're doing, and when you're listening to people, you listen whether what's being told is divisive or if it's uniting. Because there's a right way of doing it where you unite people, and there's a divisive way of doing things. Now, shaming is necessarily will be reaching its goal, right? It may reach its goal with some people, but most people won't say, oh my gosh, yeah, I'm sorry, I'm not. But there are different ways of doing it. And same thing, like if you see a message online or a post on Instagram, and if that post may sound not divisive. For example, for women are not, giving equal rights. I still think divisive. There's a different way of, you always wonder, why is this person saying it like that? Making me not feel good. When something doesn't make you feel good, you wonder why. Because that person's goal, if that person's goal is to empower, let's say, a certain group, there's a different way of doing that, right? As opposed to pointing that out, because pointing that out doesn't always accomplish the goal of actually empowering. I don't know if that was clear, but be very careful with the messaging on Instagram. Did that answer your question?
Yeah, I think that mostly answered it. So hopefully the person who asked it got a better understanding of what they were wondering. I think those
Absolutely.
I think those are all the questions that we have, unless somebody wants to ask one right now. But if not, I just want to thank you one more time so much for coming on here and explaining what we can do together to stop the spread of COVID-19 and to spread more awareness on the severity and different factors that come into play with the virus, such as this one.
Absolutely. You guys are doing great jobs, and just work together, and we are very hopeful about the future, because seeing you, all of you, how hardworking and passionate you guys are. Keep up the good work, and you're going to do wonderful things.
Thank you again. Thanks everyone for listening, and I think that's going to conclude this first live stream that we have. Thank you.
You're welcome. Bye.
Bye.